The Public Health Agency of Canada just won't leave us alone. They have another psyop in store for us, and I've got the documents to prove it. The Public Health Agency of Canada has just put out a procurement notice asking for infrastructure to support large-scale, design-focused behavioral studies. Now, that's the language they chose. Behavioral, design-focused, and at scale. The stated priorities of this procurement notice include vaccination uptake, mental health, and of course, climate-related health challenges. These aren't treatments, these are behaviors. Behavioral modification, actually. They want compliance, obedience from you. This is the Public Health Agency saying plainly that it wants better tools to study how Canadians act and how to influence their behaviors to bring them in line with government priorities. This matters because we already know how the Public Health Agency of Canada operates. During COVID, the Public Health Agency of Canada admitted that it tracked the mobility data of 33 million mobile devices in Canada. That's nearly the entire adult population. They did it without warrants. There was no individualized consent. In fact, your cell phone provider sold your information for a profit to the Public Health Agency of Canada, and you didn't even know about it. Movement data was collected to measure compliance with lockdowns. That happened. They admitted it. Now, at the same time, during the pandemic era, internal government documents show the Canadian military was running influence and propaganda exercises. One exercise involved circulating a fake story about wolves being released as a test of information spread. Senior officers later admitted that these activities risked undermining public trust. You think? Now, the Public Health Agency is institutionalizing this sort of manipulation work. This procurement request is about building permanent capacity to monitor you, to study you, to conduct behavioral research tied to government objectives to make sure we're all obedient little drones in the end. All of this is happening while the Public Health Agency continues to fail at the thing that it exists to do. The agency has repeatedly had to destroy millions of dollars worth of expired PPE, masks, gloves, gowns, sitting in warehouses until they aged out and are thrown away, inventory mismanaged, rotation failures, distribution failures, just writing things off because, well, the taxpayer is paying for it. The Public Health Agency of Canada could not manage boxes on shelves, but now it wants sophisticated permanent infrastructure to study and influence the behavior of an entire population. Now, if the priority were preparedness, the investment would be in logistics, stockpile management, hospital capacity, staffing, emergency response systems that actually function so that you don't have to lock down a population to protect healthcare. Instead, the investment is in behavioral science. And the language is explicit. Their history is documented. The pattern, well, it's patterning. Tracking people, testing messages, studying compliance, building tools to do it again and again. When government agencies define behavior as a health problem, personal freedom becomes a variable that they just need to adjust. Travel, movement, medical decisions, energy use, speech, all become subjects of research rather than rights to be respected. The Public Health Agency of Canada isn't taking on a study about how they should be more competent. It's asking how it can be more effective at controlling you. And that tells you everything you need to know about what comes next. For Rebel News, I'm Sheila Gunreid. I'm going to find out as much as I can about this request for procurement. If you'd like to help me in my research efforts and filing fees, please go to rebelinvestigates.com.